Within the last 2 decades, the ultrasound machine has migrated outside of the radiology suite and has now begun to be used by the non-radiologist in the medical wards, intensive care units, operating rooms, emergency rooms, and clinic offices. Doctors from multiple clinical fields have started to utilize these machines at bedside for both procedural applications and for diagnostic purposes. This video will introduce the basics of bedside ultrasound and will outline some common applications of bedside ultrasound in medicine today. The ultrasound machine has a monitor upon which to visualize scanned images. Accompanying this monitor is a keypad, which typically has function keys, knobs, and dials that are integral to ultrasound scanning in terms of image acquisition, image processing, and scan optimization. Keypads on various machines may range in complexity, with some quite simple and others quite complicated. Various ultrasound probes may be attached to the ultrasound machine, which are used to scan the patient and obtain images. The ultrasound probe, also called the transducer, is the site of ultrasound wave production. The probe both transmits ultrasound waves into the patient and receives ultrasound waves back for analysis and image production. Probes often vary in shape, size, type, and frequency range. This is an endocavitary probe, commonly used for pelvic ultrasound. This is a curvilinear probe, commonly used for diagnostic ultrasound of the chest and abdomen. This is a phased array probe, commonly used for diagnostic ultrasound of the chest and abdomen, and especially for echocardiography. This is a linear probe, commonly used for procedural applications. Most ultrasound machine configurations will have probes of usually 2 types: the linear probe and the curvilinear probe. To change between various probes, you will need to either physically change the probe attached to the machine or utilize a probe selector button to allow interchange between probes. The linear probe is the probe with the flat top. These probes are high-frequency probes of usually greater than 11 megahertz. Linear probes transmit and receive sound waves in a linear fashion, which allows for more of an anatomically accurate ultrasound image. In general, this is the probe utilized for most procedural applications, given its high frequency allows for best resolution and optimal visualization of superficial fields and structures. Examples of such applications include soft tissue infection assessment, vascular access, regional anesthesia, foreign body assessment, and ultrasound-assisted lumbar puncture. The curvilinear probe is the probe with the curved top. These probes are low-frequency probes of usually less than 4 megahertz. Curvilinear probes transmit and receive sound waves in a splayed fashion. In general, this is the probe utilized for most diagnostic ultrasound imaging techniques, given its low frequency allows for best resolution and optimal visualization of deeper fields and structures within the body. This is the probe most often utilized for ultrasound assessment of organs within the chest and abdomen, such as for the FAST exam, gallbladder imaging, or aorta assessment. Another probe that is useful in the assessment of chest or abdominal organs is the low-frequency phased array probe that will produce images of similar appearance to the curvilinear probe, and in general, both probes can be used interchangeably. Notice that this probe also has a flat top, yet do not confuse it with the high-frequency linear probe. The phased array probe head will be flat, yet more square in shape when compared to the flat rectangular head of the linear probe. Ultrasound probes usually have a probe marker on their casing that will aid orientation of the probe in relation to the ultrasound monitor and in scanning the patient. To confirm the proper orientation, hold the probe in front of the ultrasound monitor and apply ultrasound gel to the left side of the probe, or touch the left probe surface with a fingertip. If the probe and monitor are in properly related orientation, the monitor will show ultrasound propagation on the left side of the screen. If the probe and monitor are not in properly related orientation, the monitor will show ultrasound propagation on the opposite side of the screen. Simply rotating the ultrasound probe 180 degrees will correct the improper orientation. In general, you should hold the ultrasound probe as you would a pencil, with the probe secured lightly between the thumb and forefinger. When imaging a patient, be sure to apply appropriate conductive gel on the probe surface and gently place the probe on the patient in the proper orientation depending on the exam type. Most machines have various imaging modes. The most common modes are B mode and M mode. Novice sonographers will likely only need the B mode, also called the brightness mode. This mode provides the typical 2D ultrasound image that most clinicians associate with diagnostic ultrasound imaging. For the more advanced sonographer, use of M mode or motion mode may be useful. M mode applies a reference line along a single channel of ultrasound waves and provides the sonographer with a tool to assess for movement along that reference line. Another imaging option is to place color on the image, which is technically called color Doppler ultrasound. This imaging option is very useful in detecting and differentiating vascular blood flow. In general, arterial blood flow will be more pulsatile, whereas venous blood flow will be more laminar and less pulsatile. Of note, the colors often applied to the vascular blood flow by various machines will be red or blue, yet this does not necessarily mean that red is arterial or blue is venous. During general scanning, signals return to the ultrasound probe from the interrogated tissues and an image is produced. Gain adjusts the amplification of the received signal used to produce the visual image on the monitor, similar to the volume knob in an audio system. Raising the gain will make the image brighter, whereas lowering the gain will make the image darker. During scanning, there is an optimal gain setting that allows best evaluation of tissues and structures. When imaging, adjust the gain setting to optimize imaging by turning up and down the gain. Be careful not to overgain during your imaging. Overgaining is demonstrated here, where the gain has been turned up too much, and everything is overly bright, which hampers image interpretation. Also, be careful not to undergain during your imaging. In this image, the gain has been turned up too little, such that everything is overly dark. To set gain appropriately, image the liver and adjust the gain until the liver has a gray, hypoechoic, salt and pepper appearance to its parenchyma. Many machines will have a row of sliders on the keypad which usually represent the function time gain compensation. Adjusting this function changes the gain at various depths of the ultrasound image and allows for fine-tuning of the image. In general, the sliders at the top control the gain in the near field, or superficial areas of the image. whereas the sliders at the bottom control the gain in the far field, or deeper areas of the image. Adjustment of time gain compensation is a more advanced function, and it is not usually necessary for routine use. Novice sonographers should place the time gain compensation sliders directly in the middle of their slider path to ensure some level of image production on the monitor. Many machines will have a freeze function that will freeze the dynamic live image to a static still image. This function is often used to produce a static image for inspection, labeling, manipulation, or measurement. Most machines will have various measurement functions, such as calipers for diameter or volume measurements. Read your specific machine's manual to learn about your machine's measurement functions. Ultrasound machines will allow for adjustment of the tissue depth being interrogated. Depth is usually adjusted by pressing key depth buttons. By adjusting these buttons, the depth interrogated may be increased or decreased as desired. When scanning an area of interest, the target area should be centered on the ultrasound monitor screen, both by adjusting probe position and adjusting the depth. For each probe attached to the ultrasound machine, there is a range of ultrasound frequencies unique to that probe attached. Usually there is a button or dial on the machine that allows fine-tuning of frequency selection for the attached probe, which may be useful in optimizing imaging and resolution. In general, using the highest frequency possible for the linear probe attached optimizes best imaging of superficial structures. In general, using the lowest frequency possible for the curvilinear probe attached optimizes best imaging of deeper structures in the body. Oftentimes, when interpreting and describing ultrasound images, the echo or echoic nature of structures is discussed. An anechoic area will be one that does not produce any returning sound waves and will appear on the ultrasound monitor as a black area. Examples of structures that will have an anechoic black appearance include patent vasculature, fluid-filled structures, and areas of shadow. A hypoechoic area will be one that produces few returning sound waves and will appear on the ultrasound monitor as a gray area. Examples of structures that will generally have a hypoechoic gray appearance include the parenchyma of most solid organs, especially the parenchyma of the liver or spleen. A hyperechoic area will be one that produces many returning sound waves and will appear on the ultrasound monitor as white and brighter than surrounding areas. Examples of structures that will generally have a hyperechoic white appearance include dense or solid tissues such as bone, gallstones, or the muscle of the diaphragm. When scanning a patient, it is useful to remember key radiologic imaging planes. To appropriately image along an imaging plane, the longitudinal axis of the ultrasound probe should be parallel and in the same direction of the imaging plane. The sagittal plane will transect a patient in this plane. The coronal plane will transect a patient in this plane. The axial plane, also called the transverse plane, will transect a patient in this plane. There are multiple well-accepted applications of ultrasound that will potentially enhance your practice of medicine, both from a procedural and diagnostic standpoint. Procedural applications include ultrasound-guided vascular access, both central and peripheral access, paracentesis, thoracentesis, lumbar puncture, regional nerve blocks, soft tissue assessment for abscess, transvenous pacemaker placement. Diagnostic applications include the FAST exam, ultrasound assessment of the aorta, gallbladder assessment, lung ultrasound, such as for detection of pneumothorax, hemothorax, or CHF, volume status assessment by inferior vena cava assessment, DVT evaluation, basic echocardiography, such as for pericardial effusion detection, critical assessment of the code patient, evaluation of the eye for optic emergencies, such as retinal detachment.